Hi there, I'm Jo from SLC, here to help you on your OET journey. So today we have an extra special guest. It's our OET hero, Femi. And today I'm going to be doing an OET speaking role play with him. So let's bring him in. Hello, Femi.
Hello, Jo.
How are you?
I'm fine.
Good, good, good.
Yeah.
How are you feeling about your OET exam? It's coming up soon.
Yeah. I'm ready now.
Good. Excellent. Excellent. Oh, well, thank you for joining me today. We're going to be doing a speaking role play practice.
Okay.
And you can show me all the things that you've been learning with Alexia.
Okay.
All right. So what I'll do is I'll share my screen and give you the 2 to 3 minutes preparation time. And then we'll give it a go. All right.
All right.
Okay, so here is the roll card. Okay, great. All right, so I'll give you 2 to 3 minutes to prepare and I'll let you know when this time's up. All right?
Okay. All right.
Okay then, Femi. So you've got 5 minutes for the role play. You begin the role play. Don't worry if I stop you, it just means the time's up. Okay?
All right.
All right, you can start when you're ready.
Okay. Hello, Jo. Good morning.
Good morning.
Yeah, my name is Femi. I'm one of the nurses today, and I'm here to have a chat with you regarding your blood test results. Is that okay?
Yes. Yeah, I'm a bit surprised by my blood test results. I'm not really sure why I need to talk to you.
Yeah, actually, it's just a brief chat to talk about the iron supplement. You know, we have to discuss something regarding your iron supplement. So I don't know if that would be all right.
Yeah, that's fine.
All right. So to start with, what do you know? Do you ever know anything about iron supplement or at all?
Nothing really. I mean, I never really think about like diet and stuff like that. I mean, to be honest, my diet's probably not the best. I mean, I eat a lot of takeaway meals and probably too much coffee, but I've not really thought about iron or vitamins or anything.
Oh, I see. I see. That's all right. Um, I don't know. I would like to explain certain things with you regarding that. I don't know if
Okay.
that is okay.
Okay, yeah. I mean, I've heard maybe there are some tablets or something. Can I take some tablets for that then?
Yeah, actually, no. I wouldn't say no, but tablet has got its own side effect. It's not a long-term solution to what we are about to discuss, actually.
Oh.
Because it also has some side effects like constipation. And now, do you understand what I mean by constipation?
Yeah, yeah.
Yeah, yeah, and also it can make your stool to be darkened. So I wouldn't advise much on that.
Oh,
Right.
okay.
Or do you have any other question?
No, I mean, what am I supposed to do then if I'm not taking tablets?
Yes, I would like to I would like to discuss about the nutritional side of it, the food you can take that can help you regarding the iron supplement.
Okay.
You know, so actually there are some food that do prevent the absorption of the iron into our system. Most of it, like coffee. People that used to take coffee, it inhibit the absorption. But fruits like orange juice can really increase the absorption. So I would rather advise that we should just intensify on eating more fruit, especially orange. Is that all right?
Okay, yeah, I can try some orange juice, I guess. I mean, yeah.
And also, I would like to add that if you can eat more of lean red meat, and also there are some fortified iron cereal that are fortified with iron, and also cashew. and some other fruit I've mentioned. They are all good in iron, which can easily boost your iron, your blood iron. Yeah. Is it clear enough?
Well, I mean, I'm a little bit surprised, to be honest, about having to do this. I mean, it just feels like an awful lot of effort, you know. I mean, I don't really like cooking and shopping for food. I mean, can I just take the pills, please? I mean,
Yeah.
I don't mind about the side effects. I'd rather just have the pills.
Actually, a lot of you also have a lot of people like you that used to complain, but it's all right. But at this moment, I'm just trying to consider the side effect. And because tablet doesn't have long-term solution to what we are talking about here. So we are looking for what can give us a very long-lasting solution to what we are talking about. So we advise you to please go on diet that can boost the iron rather than taking tablets. Though I'm not saying we shouldn't take the tablet. All right?
Okay. I mean, if I really have to.
Yes, I will still have to suggest that you take more of diet than, rely on that on tablet, because of the constipation. And I'm very sure that it's gonna help you, especially at this moment that we need the iron in your blood. All right. So is there any other concern you've got?
No, that's fine. All right. Thank you very much.
So Alexia, we've for the sake of summary, we have talked about what to take, the kind of food that can easily inhibit the absorption of iron. We mentioned coffee, and we talked about orange, how it can help us, cashew, and other lean meat. So I would like you to please adhere to all this advice. And in case you have any other question, you are free to contact me.
Okay, thank you very much, nurse.
All right.
Okay, done. So how did you feel that went then, Femi?
I think I'm still learning though. I'm trying to just, just try to keep up with what my teacher has been teaching me. So I think, I know I'm not perfect yet, but I know I will. I'm doing a lot of practice at home at this moment.
Yeah, I mean, I think it was a really successful role play. I think you got your messages across. Is there anything that you feel that you maybe left out or didn't do enough of?
It depends on your judgment.
Okay, all right. Well, let me talk you through. I made a few notes. So introduction was fine, who you are, and then you explained why you were going to talk to me today, and that was fine. And you started off with a question, so you found out what I knew about it. And you had lots of nice active listening throughout as well. Oh, I see, that's all right. You also had some good signposting and linking phrases in your explanation. So you said things like, okay, I would like to explain some ways to increase iron absorption, etc., which was great. When I asked about the tablets, you explained about the side effects and then turned that into advice. So I would advise the suggestions that I'm going to explain to you. Yeah, and I think you explained them well. What I should do. So to do orange juice, to try orange juice, and you did lots of checking throughout. Is that okay? Is that all right? Things like that. And then you also added then on top of that about the lean meat, cereal, and the cashew nuts, and you checked as well. And then I said, well, can't I just have the tablets the easy way? And I think this is just the little bit to improve on. I would have had added a little bit of empathy there, because I said, I think it's a bit difficult. I don't really like shopping for food and things like that. And what you said was, actually, a lot of people like you, I know a lot of people like you who used to complain, but, tablets have are not a long-term solution. So just be careful of saying, who about telling me that I'm complaining, because that could be considered a little bit judgmental. What I would do is add an empathetic phrase there. So saying, you know, I understand it's difficult to change our diets, but, and then stress the importance, you know, saying, you know, the tablets are not, unfortunately, the tablets are not a long-term solution. And, you know, it's really important that we increase the diet in your body, and maybe explain why, you know, what's the consequence of a lack of iron. So that would be my constructive criticism just of that bit. Yeah. So right. If they say, oh, I want the pills, this is, you know, empathize. I know it's hard to make changes, but so empathy first. And then I said, do I really have to? And then you said, yes, I advise you to please go on the diet, which is fine. So I think, you know, if it's really important and you're trying to persuade them, make sure you use that language. So you start with, I advise you, you should. And if I say, oh, I don't really want to, then step it up a level. Yeah, I understand, but is really important. And yeah, and then you asked if there were any other concerns, and did a brief summary. So yeah, I think it was a successful role play. The only other thing that maybe you could sort of squeeze in there is exploring if I have any particular concerns, you know, can I ask you why you don't want to try changing your diet, maybe? Because we know that criterion is quite difficult to achieve, isn't it? The exploring the patient's ideas, concerns, and expectations. But having said that, Femi, I think, you know, you got your message across, and I would have left that consultation very informed and knowing what to do.
Thank you.
Okay.
Thank you.
Yeah, so just remember to, you know, keep your nurse's hat on and just pretend like it's a real consultation. Remember that empathy. Remember to explore those concerns. Keep doing that signposting, linking, and checking, which you seem to be doing quite naturally now, which is really great. And I'm sure you'll do a really great role play in the exam.
Yeah, thank you.
All right then, Femi. Well, thank you very much for joining me today. It's been a pleasure to have you.
Thank you so much.
And good luck in your exam and with the rest of your preparation.
Thank you so much. Thank you so much.
All right, Femi, have a great afternoon.
Thank you.
So thanks for watching. We hope you found the OET roleplay with Femi useful, and perhaps you learned some things to help you with your preparation. Don't forget to subscribe to our YouTube channel. We've got loads of videos to help you on your OET journey. Hit the bell so you're notified every time we post a new video. Also, check out our website. We've got lots of useful resources to help you ace your OET exam. Bye.